I'm Dr. Charles John Buckman, obstetrician gynecologist. Yes, I actually recommend that to my patients. If someone comes and, let's say, let me give you a typical scenario. We had a patient who, the 12 weeks, no heartbeat. I had seen her 2 weeks earlier. There was a heartbeat, everything was fine. She came back 2 weeks later, there's no heartbeat. And I recommended that she go somewhere else, does a scan or see another gynecologist to ascertain whether I'm right or not. So that, if she decides to come back for us to probably get the baby out, yes, we can. But if she wants to carry on somewhere else too, that is fine. It's actually good because you can make mistakes. So it's actually good that you ask your patients to have a second opinion, especially for some adverse outcomes in their care. So that, because you can make a mistake. So if somebody else too has a look and thinks the same, then both of you are on the same track. That's the essence of that's the essence of the reason why in large hospitals you have ward rounds, because then all doctors bring their ideas on the management of a particular patient so that collectively you can help a patient. As the Akan proverb says, the Jansen Bakufo trim sort of, yeah. So I think it's a good thing to do. Our advice that pregnant women should visit the hospital once you miss your period. It's a good time to visit the hospital. The first time doesn't mean you'll be seen frequently. If everything is fine, you may be seen maybe after 2 to 3 months. It's important in the sense that we're able to pick up ectopics where the pregnancy didn't form or didn't situate in the uterus, but it's outside the uterus, probably in the tube or outside the tube. That's the only time we'll be able to pick it up. And if you pick up an ectopic which hasn't ruptured, it's better and safer for the woman than when it ruptures. Let me put it this way. Some women may come when they are pregnant at about 10 weeks or let's say 2 months. By that time, if it's an ectopic, it's likely to have ruptured. So you will come in with pain or feeling dizzy. And then when we check, we'll notice that you have an ectopic and it has ruptured. We may have to operate. But if you had come earlier, just when you had missed your period, would have done a scan, you will have noticed that the pregnancy is not in the uterus. So then you can have even just tablets or injections to take care of the ectopic. So early presentation to hospital with missing your period is important. So because it helps us to pick up problems you may have and then help us solve it for you. Also, I'll recommend that women eat well. Sometimes because of the cravings in early pregnancy, they eat all sorts. There's something called pika, where women eat this white stone, and they claim they have a craving for it. It's actually causes anemia because it's sort of, when you eat, and the iron content that will be absorbed by the body will be chelated by these stone particles, and so it can lead to anemia. So usually when you come, we advise you not to eat such. So women should please avoid such cravings. Also attend your clinic regularly as much as you can, so that if you have any problem, it is easily picked up.